much, Michael, for those remarks. Our final speaker now in this opening session is Sarah O'Toole. I'd like to invite Sarah, who's the CEO of CBM Ireland, and Sarah's also the current chair of DOCUS, which is the Irish Association of Non-Governmental Organisations.
Thank you, David. Good morning, everybody. My name is Sarah O'Toole. Yes, I'm the CEO of CBM Ireland and chair of DOCUS. And CBM Ireland is an organisation focused on disability inclusion in international development programming and humanitarian action. We're delighted to be here today as a special conference partner of the Irish Global Health Network. And it's great to have so many people in the room physically and also online. Over the past number of years, I suppose we've all had to look beyond the physical barriers to gather together. And this has enabled those who were previously excluded to now be part of and actually lead conversations. And I'm also delighted today that we have some sign language interpretation and some captioning online to make this a truly inclusive event. CBM Ireland is part of the CBM Global Federation. We work in 20 countries in the Global South, and we are driven by our mission, fighting to end the cycle of poverty and disability. As we know, people with disabilities living in poverty face stigma, violence and discrimination, and face many barriers to access healthcare, rehabilitation, safe and accessible living environments, education and employment. And they are often forgotten in mainstream development, humanitarian and climate actions. In emergencies, they are also one of the worst impacted and face a higher risk of being injured or losing their lives during a disaster. And due to historical exclusion, people with disabilities are often being hit the hardest by the impact of climate change. Therefore, we very much welcome the theme of this year's conference on global imbalance and social inclusion. It is clear to us that the COVID pandemic has exacerbated the marginalisation of people with disabilities in terms of access to healthcare, information and indeed vaccines. Research has shown that people with disabilities, in particular those with communication disabilities, are less aware of the services available to them, how to access them, and indeed being fearful of doing so. In order to address this gap, people with disabilities and their representative organisations must be included not only in the delivery of such services, but also in their design. Gathering evidence on the experience of people with disabilities living in poverty can also be challenging. The nature of research is oftentimes exclusionary, as it is not disability-led, nor does it account for those with communication disabilities. Support is needed to ensure authentic participation of people with disabilities in research that leads to policy or programmatic decisions that directly affect them and their lives. So we really look forward to the conversations over the next 2 days here and hope they continue long afterwards. We believe there's a lot of commitment here to actively address inequalities and exclusion. We commend Irish Aid's commitment to reaching the furthest behind, which strongly demonstrates the vision we all want to adopt in our work. The inclusion of people with disabilities and their agenda has the power to transform global health systems. Let the conversations of this conference foster that idea that access to health is for all. Ireland has ratified the UN Convention on the Rights of People with Disabilities, making it mandatory for Ireland to ensure that its programmes, policies and actions promote the authentic inclusion of people with disabilities and their representative organisations. However, this will not be realised without human intervention and, I might say, funding. Our planned conscious actions, supported by our commitments and values, will only make this possible. Thank you.